All right, welcome everyone. Thank you so much for joining us today. I'm Allie Cox. I work with Gina Burleski at Penn-Mar Human Services, and she unfortunately couldn't be here today, so I got voted to learn how to run a Zoom meeting very quick. So please bear with me for any technical difficulties that we have. Nicole and I met a couple of times, and hopefully we've got it down. So Abby Brenneman is also here with me today to help with anything that I might need help with. So Nicole, did you want to get started with telling a little bit about yourself and who you are and all the amazing things that you've accomplished?
Welcome. Thanks for joining, everyone. My name is Nicole LeBlanc. I live in Silver Spring, Maryland, outside the land of chaos. I'm originally from Vermont. I'm the author of the book Disability Employment Policy 101 that I completed during my SARTEC fellowship, which SARTEC stands for Self-Advocacy Resource Technical Assistance Center. Currently, I'm the PAL coordinator for the National Center on Advancing Person-Centered Practices, and I'm the advocacy specialist for the state of Maryland. I'm also a graduate of the Vermont LEN program 2018. And for information on to get access to my booklet, click on the link below. And that picture you see there is me giving they're at an awards ceremony for Tom Harkin in 2012. Quote of the day: true individual freedom cannot exist without economic security and independence. Franklin Delano Roosevelt. Never impose on others what you would not choose yourself, which is especially important in this day and age of trying to move away from segregation. And during a time when we have people that are fighting to keep institutions, shelter workshops open, when they say community is for some, not for all. Disability is a natural part of the human experience. If we all live long enough, we'll all join the disability club. Next slide.
Nicole, I know that you have, during the pandemic, there's been a lot of challenges and a lot of opportunities to support people through virtual supports. Can you talk a little bit about that?
Well, the COVID-19 pandemic has moved much of our education and work world online. This presents both challenges and opportunities for people with disabilities alike. One of the major advantages of remote employment is that it eliminates transportation barriers that many people with disabilities, particularly those who've ever had a job that's in an area that isn't on public transit that you can easily get to, who don't drive and have to deal with things like unreliable, poor quality paratransit that either shows up too early or too late, traffic, long commutes. Like in this state offices are in Prince George's County, which doesn't really have much transit. There's not much there's no straight shot from Silver Spring, for example, to Laurel. COVID-19 has shown the world that many jobs can be done remotely. Remote employment opportunities are a great way to move people with disabilities into careers, not just jobs. It's a great way to get away from the typical 4 F's of disability employment: food, filth, flowers, filing. Remote employment can level the playing field in professional jobs for the disability community.
I know you have also talked a lot about healthcare and the impacts. So can you share a little bit about that with us?
Well, COVID-19 has shown us that segregated settings cause poor health outcomes among people with disabilities and those of color. You know, some people out there think people with disabilities are safer in segregated environments. The research and the evidence shows that's not true. And it also shows that people who are their own guardian, the more self-determination they have, the healthier they are and the better quality of life they have. People with disabilities are a medically underserved population. In other words, often known as a MOP, which is a status designation by the CDC, Center on Disease Control. Studies show that more self-determination leads to better off in terms of health outcomes, quality of life. As a society, we need to do more to address the digital world divide among the poor and the disability community.
I know that you've talked a lot about the different ways when you and I were talking, you shared a lot of the different ways that you have experienced the use of remote supports during the pandemic. And I think what we decided on is having breakout rooms, and there will be a little blue box that pops up. And what you're going to do is you're going to click on join breakout room. It'll take a couple of seconds. You'll go to the breakout room and then you'll be with other people. So you can take a couple of minutes to, or a minute maybe, to just introduce yourselves to one another. We have a lot of people from all over with us today. And when you're in the breakout room, what you're going to do is you're going to talk about how you're using technology right now to provide remote supports to people, what ideas that you might have in supporting people remotely, and then how we're bridging the digital divide. So, you know, what kind of things have you thought about, or what maybe things should we be thinking about in terms of getting people the technology that they need to be able to connect and utilize virtual supports?
Yeah, and it can be broad, employment, independent living.
So Nicole, while I'm getting these breakout rooms set up, do you want to give us a couple of examples of what you've done so far through virtual supports?
Yeah, for one example, in Vermont, we have a program called Safety Connections that allows people with disabilities to live in their own apartment, and it's a system that you arm at night. So let's say if something all of a sudden happens in the middle of the night, let's say somebody breaks in or something, or you have a health issue, you press the thing, you open the door, and somebody comes over the loudspeaker. They talk with you, and then if you need further assistance, a responder automatically comes over to help you with whatever you need help with.
That's in Vermont?
Yeah, and then in Burlington, Chittenden County area.
What about Lamoille County? Because I've never heard of that before.
Yeah, and then it's an idea that came from progressive idea that came from Wisconsin, because they have things like Rest Ashore and similar programs. And the state of Vermont has been, Chittenden County, they've been able to get through Howard Center Developmental Services, which is the largest provider agency in the state, and they've been able to also get Section 8 vouchers quicker through it. Yeah, so if you have somebody, let's say, who, doesn't want to live in a place where they have a gazillion people everywhere, this could be an option.
Wow.
Alrighty, so if we're ready, just as a reminder, we're going to go into the breakout rooms. You're going to talk about how you're using technology currently, what ideas you have for supporting people through remote supports, and how we're bridging the digital divide. And what we'll do is when we come back as a group, we'll have a couple of people share. And then for those of you who don't get the opportunity to share, we will have you type in the chat. So please make sure you identify somebody to report out for once we come back. So this works best if you rub your hands together really, really fast. It's the only way you can get off into a breakout room. You got to rub them together. Where are your hands? Come on. Let's go. All right. Are we ready? All right. We'll see you guys soon. All right. Looks like everybody should be back. So we have probably enough time for about 4 people to share with us, and then whoever doesn't get a chance to share, you can just go ahead and type it in the chat. We'll send a follow-up email with everybody's comments. So you can either raise your hand manually or just kind of wave at us, and Abby and I will try to find you.
Allie, I'll start sharing. This is Wilfried.
Awesome, thank you.
Yeah, so I was part of group 12, and yeah, and some of the takeaways which we talked about is that, like, especially during this COVID, I mean, supportive employment has basically been done virtually, and one of the things with supportive employment that we talked about is that it's been necessary to talk about with our clients with disabilities about the importance of wearing a mask if they were in the field during this time, to prevent them from getting sick and touching. And because, like, I know, like, I've heard from others that the masks have caused some sensitivity issues depending on the disability. Also, instead of tuning around, there's been a lot of resources out there for virtual field trips, like going to the amusement park, going to a zoo. You could literally watch live penguins through a virtual zoo thing through cameras. one of the things that we talked, like a big thing we talked about, is that we've had a lot of Zoom meetings going on, and finding avenues for people to go online. And one of us talked about, especially with autistic individuals, it was difficult for them to process from going to the Zoom meetings due to their sensory. So like we talked about how we started with just having them do phone calls, and then them like going onto Zoom to type things, looking at the camera, and you have to take a baby step by step in order to get there. And also, not all companies have been willing to help people with disabilities go the extra mile. And we talked about how it's important to making sure that we are employed, because especially during this pandemic, one of my colleagues from APSE, the Association Supporting Employment First, Julie Christensen, was featured in the article by CNN about how this workforce with COVID-19 has impacted the people with disabilities, and that we have to like retrain people with disabilities to go work maybe in other jobs that are going to have more higher opening rates. And that's working with the job developers, the job coaches, vocational rehab, to making sure that we have the most competitive integrative employment opportunities for people with disabilities.
Awesome. Thank you for sharing, Will. I appreciate it.
You're welcome.
Diana King had her hand up then.
Awesome.
Yeah, I can go ahead and share what our group talked about.
Great.
We had talked about what it was like transitioning onto online platforms for services, and I know the examples they had were like Facebook Messenger was really good for some community members to get online and play bingo or whatever their activities were for that time frame of their schedule. Obviously, Zoom has been one of the things that's been helping with staying in touch and connecting and having some sort of service or support. There's also one of the people in our group sent packets via mail, and those packets tend to be mailed back to them. So they said they've seen a lot of good back and forth between having these packets being completed and actually keeping them engaged at home with these certain activities that they send out. Now that some of the restrictions have been loosening up, I know that a lot of people have been starting to go back into the community, using their face mask, getting some sort of distancing, but also in-person type thing in terms of community supports. Some of the people who haven't been able to use Zoom, which in our group we've discussed a lot of the, older folks we serve might not be able to navigate being online. We use the phone with them or other types of means to be able to keep them fully engaged in program. But again, there are certain things that we've seen that are barriers that haven't allowed us to connect 100%. I do have a lot of Latin families. They tend to use like a WhatsApp app instead of using other types of forms of messaging systems. That has been helpful, but again, it still creates a barrier in case you want to do certain supports or certain activities with them. Just doing everything over phone or text have been quite difficult. One of the ladies does have an organization that has been able to create PPE for their staff. So they've been able to, again, with the loosening of restrictions, have appropriate PPE and guidelines in place so that they can help within the community once they start going back. My organization allowed us to deliver Chromebooks and tablets to those that can navigate online, so that way we could have full engagement for those folks who did not have any kind of tablet or Chromebook to use Zoom or Messenger. But again, I think we still see kind of barriers in terms of getting all of our people engaged and all of our people appropriate and quality supports. Even through all these means that we've been trying, it's still rather difficult to do certain things safely with them without seeing them physically in person.
Absolutely. Thank you, Diana, for sharing. Nicole, I see that you made a comment about anxiety about going back to work, or that being something really big right now. Did you want to speak at all to that?
Yeah, that's definitely especially with parent like 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 for the state of Maryland, we're basically staying telework indefinitely. And like as I said, I'm like I'm not in no rush to jump on paratransit or anything. I'm like
Is there anything that you have in mind, Nicole, to help with people that have the high anxiety about returning to work? Any tips or tricks that you could share with the group?
I think the biggest thing I think is speaking up and telling people, okay, what are you comfortable with? What are you not comfortable with? Like I'm more comfortable. Okay, get in a car with somebody I know versus somebody I don't know.
Yeah, absolutely.
Like for instance, here I have to have the rest of my wisdom teeth out in July, and I'm having somebody I know take me. Avoid, the less we can, the more avoiding of, taxis and Lyfts and Ubers for right now, the better.
Yeah, for sure. And I know that there's limited public transportation right now as well. So it sounds like everybody had some really great conversations. If your group didn't get a chance to report out, you can feel free to type it in the chat. Like I said, we'll send a follow-up email and we'll include some of those comments. I know Nicole has a lot more that she'd like to talk about. So want to get back to that. So Nicole, what kind of tips can you share with us in terms of providing remote supports?
Are we going to go to back to the PowerPoint?
I am.
Check in often. This is a great way to reduce isolation and loneliness that sometimes can occur in remote settings. It's a great way to give people reassurance that everyone is on the same page, stuff is getting done correctly. And lastly, to ensure that people are getting enough support they need. Ensure high quality digital access, remove any digital barriers to active participation. Video platforms should be accessible for all people with disabilities, manage their strengths. Always have a call-in number. Focus on true inclusion for all. These programs like Zoom, Google Hangout. Out of all the programs, and of course you got GoToMeeting and all that. Out of all the online meeting platforms, I think Zoom is what I like the best. Keep routine and structure as much as possible. Encourage stretch breaks. Many people with autism perform best with structure. Surround yourself with computer geniuses who can fix technological malfunctions. Use platforms like Google Docs where you can, make a document, somebody else can edit it and type at the same time. Google Docs is one of the greatest things they invented. It cuts down on the need to, send a gazillion emails, draft 1, draft 2, da-da-da. Which if you're somebody who's always disorganized, sending a gazillion emails and a gazillion drafts can drive one bananas. So Google Docs is one of the greatest things everybody should use.
Thank you. So tell us a little bit about your work with the National Center on Advancing Person-Centered Practices.
The National Center on Advancing Person-Centered Practices is a project funded by the Administration of Community Living. It's funded for a minimum of 3 years. It's an initiative by ACL and CMS that helps states, tribes, and territories implement person-centered thinking, planning, and practice in line with U.S. Department of Health and Human Services policy. The big dream of this center/project is to move our HCBS system from being system-centered to truly person-centered. And this, a while back, there was a white paper written on an idea for a project like this. Back in the day of the CMS, and this ties in with the home and community-based settings rule. The goal of NCAPS is to promote systems change that makes person-centered principles not just an aspiration, but a reality in the lives of people who require services, long-term services, and supports across the lifespan. This project supports a range of person-centered thinking, planning, and practices regardless of funding source. And here is a video that I recently made. The pandemic is an opportunity to improve person-centered supports. And the NCAPS website is listed below the YouTube video link. And I highly encourage you to go on the website. We also have a Facebook page. Like us on Facebook. And we have a webinar coming up on the 15th that's talking about stakeholder engagement. I highly suggest you turn into that. Our last webinar was on cultural competence. SARTEC. SARTEC stands for Self-Advocacy Resource and Technical Assistance Center. This was a grant that was issued at the end of the Obama administration in 2016 to SAVE, Self-Advocates Becoming Empowered, Green Mountain Self-Advocates, Autistic Self-Advocacy Network, TASH, and a host of other partners. The mission of SARTEC is to strengthen the self-advocacy movement by supporting self-advocacy organizations to grow in diversity and leadership, to share best practice tools, conduct interviews with self-advocacy leaders, share success stories, provide training and assistance, and to provide self-advocacy leadership opportunities like the SARTEC Fellowship. Also to, compare the differences between all the civil rights movements. It's funded via the Project of National Significance. It's 5 years. SARTEC also offers policy and leadership fellows. 24 self-advocates are chosen over 4 years. In my case, I was the second cohort. I developed a booklet called on Disability Employment Policy 101 that self-advocates and allies can use to push back against people out there that say we should keep shelter workshops and stuff open, because there's groups that want to open up the WIOA, Workforce Innovation Opportunity Act regulations and weaken them. Everybody in the community can work regardless of severity of disability. We need to move away from all this, communities for the, high functioning, my child's too disabled to work in the community. No one is too disabled to live and work in the community. If we all live long enough, we'll all join the disability club. Disability is a natural part of the human experience. When given the right supports, anything is possible. And if we all live long enough, as this, pandemic is showing, we're all going to join the disability community. And here are some great resources on Think Work, the project, the NIDLA grant that was funded, where we made a report talking about employment. There's a webinar link that I've done on informed choice and employment.
Nicole, I know that you had said that you wanted to open up for questions. Did you want to do that now?
Yeah,
in the next 5 to 10 minutes? Okay, great. So if you have any question, you can type it in the chat and we'll read it, or you can certainly unmute yourself and Nicole will take questions.
Nicole.
Ask away.
Hello, I'm Lori Elston. I'm from Oklahoma. So you have provided some really great resources. Would there be a way for us to receive those, either the PowerPoint and or the resources through our emails?
Sure, we can send it out.
That would be great. Thank you.
Nicole, I'm Jeff. I live in Denver, Colorado.
My brother recently moved there last August.
Oh, really?
Yeah, so you might get a bunch of sunshine, so please send DC sunshine.
I got Telluride in the background right now. I wish I was there. So my question, you talked about a book or guidelines that you guys wrote, Employment 101 by Self-Advocates.
Yeah.
How can I access that?
Awesome question. If you go on the SARTEC website, selfadvocacyinfo.org. You can find it under resources. You can also find it under the sections where they have list of self-advocacy fellows.
Okay. Yeah, I would like to take a look at that for sure. Thank you.
Any other questions? Ask away.
Yes. Hi, Nicole. This is Will here. I'm asking you, what strategies would you give to employers after this pandemic on the importance of hiring people with disabilities in their jobs, in their companies that they haven't had them before?
Well, people with disabilities, are some of the hardest working people, where it's, hiring people with disabilities is a great way to reduce turnover. It can lead to a better bottom line, which is an initiative I know that, Wisconsin has done, better bottom line initiative. Diversity is great for business. It improves morale. It can, improve profit and everything. We need to embrace diversity more and more, both in terms of, disability and race. We need diversity across the whole spectrum between disability and people of color. It's time to make the workforce more diverse. And given the fact that there's gonna be eventually a workforce shortage due to all the aging baby boomers riding off into the sunset, the disability community is the perfect solution to help fill the gap. And and start by doing things. Get creative, job carving. We need to move away from just sticking people in any job. Focus on carving the job to a person's strengths. And sometimes it can make somebody else's workload lighter, and ultimately increase productivity. Embrace flexible work arrangements. Give people to-do lists, provide structure. And providing support. Is most important. Too many times you see places where people, go one place, but yet they hire somebody with a disability, but they don't give them the support. It's a two-way street.
Yes, like Nicole, like this makes me think support the employment first movement.
Yes, Maryland is an employment first state, and Maryland is the second state to pass a law outlawing sub-minimum wage called the Ken Capone Equal Employment Act. And another thing that's important is when we look at moving away from shelter workshops to real jobs, real pay, is invest money in self-advocacy, because that way you build social connections. People don't miss the workshop, they miss their friends. Develop, freely help people, support freely given relationships. Unpaid relationships. That way you get out into the community, build social capital. It's one thing to close the walls of segregated settings, but it's another to, end all the negative attitudes out there and the invisible walls.
I have a question. Nicole, for right now during this time, even though we're having more states loosen their restrictions, what kind of tips could you give for direct support to directly support those who are looking for a job, who are looking for remote paid employment? What kind of things can we do to assist them appropriately while we still have to be remote?
When it comes to, well, help them, fill out, applications online and navigate the whole, online system, which sometimes can be complicated, more so than just filling out paperwork. Help them practice for a virtual interview. Look at, ways, depending on if you're looking to get somebody in a nonprofit, figure out, okay, I have somebody who can do this, work with the employer and the person using a dual customer approach to carve a position that's a win-win.
I have a question. I'm a job developer, but my program focuses on the film and media industry. Right now in California, the governor has approved studios to reopen starting the 12th. If it is a unionized studio, there is a specific person that's in control on the set for things like making sure equipment's clean, the environment's hygienic. However, if it's non-union, those rules don't apply. And my question for you is, as a job developer, how do I support not only the client that I'm serving, but also their families with concerns about potential exposure? I know that there is no mandatory testing. There are vaccine trials that are going on. But in the industry that I work in, there are jobs available, but there is this fear that's very valid. And I'm interested in knowing if you have any strategies for how to support during this time.
What types of jobs are there? Because what is it, the union saying one thing and non-union?
Yes, so the union has standards for everybody that's on set, for actors and crew.
Okay.
Non-union jobs could be, say you work for a videographer, you work for a private entertainment sector, versus working at a major studio. And I think that the discrepancies, they have come out with suggested guidelines, but I've heard from my coworkers that work in the field that the non-union sites are not following them. And some of them have actually turned down jobs and not recommended them to our students because of the safety hazard.
Basically, so what, this is a company that isn't just taking any precautions?
Well, in this industry, it's very strange because, most of the actors that we're used to hearing big names for are a part of unionized organizations. And there are health and safety precautions that are put into place specifically for those unionized members. However, if you are acting for, say, a commercial for a plumbing company, or you are the script writer for an independent feature film where there is not a unionized crew, there are no mandatory standards in place. There's no rule that says that you have to have a hygienic environment, that you have to have somebody assigned to make sure that the crew is safe.
Sounds like an issue that needs legislative advocacy.
Absolutely.
Yeah,
But in
that's
the
one thing
meantime, I have a lot of students that have these employable skills, but a reasonable fear. And
Is this like a big, like, could you, let's say, I don't know, if you have to bring X amount to make sure everything's clean, wear gloves and have like, different schedules where you don't have like a gazillion people in X, where you have alternating schedules. Like,
yeah,
like when we look at offices opening up, like, that's one thing I think we're going to see is, for whoever returns that, whoever can work from home will work from home, and whoever did, they'll have alternating, schedules. So everybody ain't in the same place at the same time.
yeah, and I think that's one of the things that the industry is trying to figure out. It's kind of hard to make a movie when you don't have your camera person there, but you have an actor. And that's one of the pitfalls to the particular industry that I job develop in right now. Is it's easy for us at our program at the studio when we're training on hard skills to create those staggered schedules. But translating that into real time into this particular industry, I don't know if it's going to be realistic. I don't know how producers are going to be able to sort this out. But I just don't want my students to feel like they're learning for nothing. And I know that there's a lot of fear in talking about the virus with them and with their families. And so I'm just wondering, like,
I don't know, are there any other, like, what other, interests have you expanded? Other interests?
well, this is just one employment sector of the company that I work for. The other sector primarily deals with more traditional employment, like working in an office or working in retail or things of that nature. But the program that I work for is specifically geared towards the film and media industry. And a lot of our students feel like they've been shut out of this particular industry because of their specific disabilities. So our goal is advocacy as well as employment and community integration and awareness.
Yeah, and calling attention to legislators, because Hollywood needs to be more accessible to, and embrace people with disabilities in a positive way. While also, making sure it's safe for everyone who's high risk. I, that one I would say, just keep pushing the advocacy, demanding safe working conditions.
Nicole, I know we're approaching 4 o'clock really quick. Is there I have a couple of things to wrap up, but is there anything that you wanted to say to end with the group?
Is there any other questions?
We'll probably take one more question just to be mindful of everyone's time.
Thanks for listening in. And my consulting rate is 35 to 50 an hour. if you want toolkits, stuff, made plain English, speaking engagements.
Awesome. Yeah. Thank you, Nicole, for joining us for the last hour. This has been great. And thank you to everybody for joining us as well. Just one last thing before, two last things before we depart. One, we'll send a follow-up email. It will include the PowerPoint so everybody will have access to all of the resources that were shared. We'll include a couple of the comments that were made in the comments in the chat box. So before we leave, if we could just show Nicole some love. And in the chat box, if you could just type one thing that you appreciate about Nicole or something that she shared with us today, maybe something that's a main takeaway, that would be very helpful. So go ahead and just put that in the chat, just something that Nicole has shared with us today, something you appreciate about Nicole, and then we'll send a follow-up email. Thank you, everyone.